Having a dazzling, perfect smile can drastically change how people perceive you. It can help you appear genuine and approachable, thereby opening your life and career paths to better and newer opportunities. Sava and colleagues have shown that poor dental aesthetics are linked to a lack of self-confidence, which manifests itself as an academic and occupational disadvantage. Their paper introduces the concepts of a social versus an enjoyment smile. The social smile is the one that you give when meeting a stranger to appear more friendly and likable. The enjoyment smile is when you are genuinely pleased, and this matters because the enjoyment smile typically has a higher lip line and exposes more of the gums, among other subtle nuances. The social smile is repeatable and consistent. It's something that we practice in the mirror, and so aesthetic treatment and research of the ideal smile tends to focus on giving you a pretty social smile, as that's the facial asset that you're going to be making the most use of. The formula for the perfect smile mainly depends on the facial anatomy and structure, and so we need to break down each aspect one by one to better understand the macro aesthetic of how a smile actually has an impact. The lips form the main structure of the smile, and the appearance of the lips can either make a smile seem genuine or make it appear forced. The fullness of the lips along with their shape and the length strongly influence the overall aesthetic. Recent research has explained the role of the lips in the formation of the ideal smile. According to the researchers, the ideal smile should expose approximately 75% of the upper teeth. This depends on the body and the fullness of the lips. If the lips are big and full-bodied, in other words having a lot of vermilion mass, then your smile will tend to expose less teeth and it can be quite difficult. If your lips are thin, then you're at risk of the opposite issue of overexposure, revealing too much of the teeth and gums. A good rule of thumb for those with thin lips is to smile such that the lower edge of your upper teeth touches the upper edge of your lower lip. While this example has pretty decent lip vermilion, this type of smile would be somewhere between figures F and G. In smiling this way, you can limit the overexposure of the gums, although it's not really up to you. Some people have more hypermobile lips that pull back further naturally, while others have more hypermobile ones that refuse to move back as far. In general, the lower set of teeth should not be visible, and your upper lip should be doing all of the work in an aesthetic smile. The shape of the lips when you're smiling is also very important. In general, the lips should be steady in the middle and curve lightly at the edge. There should be symmetry at the edges, and it shouldn't take more than 125 milliseconds for the edges to line up when you're forming a smile. Those with lengthy smiles that curve around the edges, like Julia Roberts, are perceived to have a more genuine smile, exposing more teeth, which we tend to associate with a spontaneous enjoyment smile, as explained in the beginning. However, this isn't the most aesthetic smile, so there is a trade-off. If the smile is not lengthy and doesn't curve around the edges, then it's best to refrain from showing too much teeth, like with Johnny Depp. This introduces another concept of buccal corridors. When the upper set of teeth do not utilize the full length of their arch, or if the arch itself is very narrow, then these dark hollow regions form on the side, making the smile seem less full. Smile profiles that open up too much, even with a very wide and well-formed arch, can also suffer from these corridors. In Growing Adolescence, Sava et al.'s paper suggests to widen the arch while it's still pliable, but this has the negative of flattening out the arc of the upper set of teeth, giving the face a broad, almost flat-faced smile that is much more masculinizing. Lombardi 1973 proposed a golden proportion of tooth exposure, which a broader arch will obviously deviate from by increasing exposure, especially at the lateral outer ends. But critics have argued that strictly following this one-size-fits-all for proportion limits creativity. On the plus side, a wider arch can allow for more room for the teeth to erupt freely, and interestingly enough, a link has been found between maxillary arch formation and tooth eruption with traditional tougher diets, which we covered here. The color of the teeth is a significant factor. While having clean, unstained teeth is important, it should match the whiteness of your sclera, which is something that people often overlook. As we've seen time and time again in our Instagram vs. reality series, teeth whitening jobs in Photoshop look uncanny because they do not match the whiteness of the eyes. Our eyes are actually a creamy off-white color, and so a natural teeth whitening job isn't perfectly bright either. Kershaw and colleagues have shown that discolored teeth have a negative impact on social perceptions. The differences between white ideal teeth and decayed ruined ones show a significant difference in ratings of social competence and intellectual ability. Another issue to consider is the shape of the upper middle two teeth, the central maxillary incisors. A smile may be considered unattractive if these two teeth are skewed, even if every other component is perfectly aligned. Apart from their structure, any gap between these two teeth or protrusions may make them the focus of your smile. For instance, a buck-toothed smile, not a canine-toothed smile or a premolar tooth smile. Although having the central incisors be a dominant part of your smile is necessary, too much can also be off-putting. In fact, the ideal height to width ratio of these incisors should be 70 to 80%, being wider than they are tall and skinny. In this example, the maxillary incisors were brought down, taking up a larger portion of the smile window than before, but not so much that it dwarfs the other teeth. Something very few people might notice are the connections between each teeth. The gap between each adjacent tooth follows an aesthetic ratio of connector bands, tapering towards the incisors with increasing connection. Having teeth that are too circular or conical decreases the available area for connection, leading to uneven gaps appearing between adjacent teeth. In this case, the gaps were filled in with an appropriate amount of resin, restoring a symmetrical balance. Lastly, the most common flaw that we see in our aesthetic reports are the proclination of teeth. Maxillary teeth that procline forwards do not form an adequate seal with the lower or mandibular set of teeth. Having the teeth procline forwards raises them up higher towards the lip line, creating a much bigger gap between the two sets of teeth, while also obscuring more of the teeth behind the lip so that they appear smaller, which is another negative. How much of the gum or gingival tissue is visible during a smile determines if that smile is gummy or aesthetic. So much so that researchers suggest a value of 3 mm or less of the upper gums to be visible when smiling. Moreover, the gingiva lining should be visible in an oval or elliptical shape when connecting to the upper teeth. In this example, the shape of the gingiva is ideal, but the lip contour is uneven and pulls back too sharply at the outer ends. In contrast, the gingiva outline here is much more uneven and distressed. Another factor of the visible gum tissue is the color and general condition of the gum itself. They should be pink in color and should not be blotchy or have black marks. In an attractive smile with an ideal smile curtain and lip profile, the gum should be mostly hidden anyway, but diseased gingiva can still stain the teeth and be inflamed, which is generally not fun anyway. Nowadays, a number of periodontological techniques can be used to correct even the most severe of cases, so it's not all doom and gloom. Facial symmetry is important on just about anywhere on the face, but even more so on the smile because it's very noticeable. The dental midline is the one that runs through the central incisors, and it should align with your facial midline, which runs down the center of your face. The issue isn't necessarily the asymmetry, but rather what the asymmetry implies, because asymmetry of your dental midline suggests underlying dental issues, such as failed tooth eruption, maxillary canting, or excessively proclined teeth. Magner and colleagues found that people deviate more towards a symmetric smile than asymmetric face, showing that smile aesthetic is on a league of its own, which is fair because it is a very broad topic. To recap all of the points that we've covered, here is an example of an aesthetic smile. Her lower set of teeth are not visible, as that is a sign of aging as the lip muscles weaken. Her smile shows virtually no buccal corridors, with the smile curtain opening up exactly in line with her maxillary or upper jaw arch. Her upper lip contour is smooth and very symmetric, revealing an appropriate amount of the incisors. It could be a bit higher and still be aesthetic, but it is within range nonetheless. Caucasians have some of the thinnest lip vermilions on average, while Africans have some of the thickest, and so the level of gum exposure will be slightly different, going down the scale from largest to smallest lips. Going back to this example, her teeth are white without looking unnatural, as we see far too often on our Instagram vs reality series. And lastly, gum and gingiva show is minimal. In the canines and premolars, where you can see hints of it, it's already very clear that the gingiva is in the ideal elliptical shape. It's also unsurprising that she has healthy dentofacial growth everywhere else on her face, and is an attractive individual nonetheless, because your smile aesthetic is intimately linked with your underlying skeletal pattern, which influences your other facial features. Apart from just the anatomic components, dentists and orthodontists have found equally important factors that can also affect the perception of the ideal smile. These factors are divided into 4 groups: gingival aesthetics, facial aesthetics, macro aesthetics, and mini aesthetics. We'll cover these as a future series, so now is a good time for me to segue into asking you to subscribe if you like research, science, beauty, and facial aesthetics. If you would like to get your own smile assessed by our team of dentists and periodontists, you can order a facial aesthetics report over at the Coos website.